And I appreciate the great questions by our members, both on the $1 million in prizes for the conclusion of the tech sprints, and I appreciate your answer to that. A follow-up question to that is whether there'll be barriers to implementation for these technologies, Dr. Worthington.
Mr. Worthington, I wish I was the doctor sometimes, but yes, I think that contracting for technology is obviously a pretty complex topic, and there's a lot of rules around how that works in the government, and that's one of the things that we work on being good at. But there are things like FedRAMP for cloud services, which is a policy designed to ensure that cloud providers have some of those data privacy protections that we just discussed. One of the challenges we see in the health space in particular is that while VA is a big healthcare provider, in the scheme of the American healthcare industry, we're relatively small. And so oftentimes many of the healthcare tool providers, they're not really familiar with FedRAMP as a compliance regime that they would be focused on. Now, they have a number of other compliance regimes from the health industry that they focus on, but FedRAMP is not often high on that list. So that's one example of some of the challenges we sometimes have at doing acquisitions of enterprise tools in this space.
In follow-up to Dr. Murphy, it was an excellent question. I had the same question on my mind. Without the full implementation and the hiccups that the VHA has had in implementing its electronic health record, that certainly is going to impact and I think delay your implementation of appropriate AI into the VA. And perhaps I'll ask that question a little bit more on the second panel. Suicide prevention is a top priority for me, for this committee, and for this subcommittee and the larger committee. And what is the VA doing in regard to using AI to better prevent or predict veteran suicide? And this may be related to my comment about EHRs. And how are we ensuring these tools are the best ones available on the market? Mr. Worthington.
Yes, great question. I'll just maybe point out two examples of our current use of AI in operations. One is we have a model called ReachVet, which is designed to predict the veterans that are most at risk for suicide as an outcome. And that information then can be used to inform the way that the doctors follow up with them or the treatments that they prescribe when they're seeing them. That model is in operations now. To provide another example, we have a natural language processing model that is looking at comments that are coming in through basically our customer experience listening. So most of those things are like, I went to the VA and the parking was slow or whatever. But occasionally those comments will indicate that this veteran might be at risk or need help. Maybe they're indicating that they're having homeless problems. So this NLP model can flag comments that might be particularly concerning for follow-up by a professional that can read the comment themselves and decide if some other action is warranted. So those are just a couple of examples of how we're trying to use these tools to help the VA with that mission. Yes.
So if I can, just on follow-up to that, given how important this issue is, if there's a flag, are you working with the clinical side to make sure that that is addressed in an immediate fashion? We have veterans who have committed suicide in the parking lot of a VA hospital because they were denied care or thought not to be suicidal.
Yes, so ReachVet that Mr. Worthington referenced is focused on veterans who are enrolled in our system, and we have seen a decrease in suicide attempts and a subsequent decrease in all-cause mortality. Hard to pinpoint that and say which is associated with suicide or not. We're also working with external contractors to use various types of AI, working with veterans who are not enrolled in our system, because when we give the numbers about veteran suicides and think about what our responsibility is, it's all veterans, not just those who are enrolled in the Veterans Health Administration.
Thank you. And Mr. Worthington, even though the VA has a published, my opening remarks called augmented intelligence AI strategy, it's difficult to find guidance on how that strategy is implemented and how VA is faring against each of their four stated objectives. Is the VA going to publish key performance indicators so that us here in Congress and the public can actively see the progress VA is making in the AI space?
Yeah, I think that's an excellent suggestion. We will be updating the AI strategy in the coming year, and I think having KPIs would be a great idea.